What's up, guys? This is Jeff from Sorta Healthy, and today we are back to talking about session design as a personal trainer. Today we'll be talking about programming for clients with knee issues. When starting out as a new trainer, clients with knee issues would freak me out. Plain and simple. One minute, this client would be feeling great, your session was going awesome. The next minute, they'd be complaining about some knee injury that they got in college. Meanwhile, I'm over here thinking, did that last exercise piss your knee injury off? Or God forbid, did that last exercise make your knee injury worse? Well, thousands and thousands of sessions later, I basically never think this way anymore. I know what to do when working with clients who have knee injuries. And in today's video, I'll be breaking down what you should do so you can feel a hell of a lot more confident than I did early into my training career when working with these clients. Or maybe you're not early into your career and you just like a few useful tips. We got you covered too. Within today's video, I'll be referencing my workout chart that I use in my own training business. This chart is free for you all to download and use with your own clients by going to this link right here. All I ask for in return for my tips and my chart are you liking the video and subscribing to the channel if you haven't done so already. This is the best way to help support this channel, which is a free resource for all fitness professionals. Thank you very much, everyone. I really do appreciate it. If you're a regular viewer of my programming content, then you probably already know a few of the things that I'm about to say. But the first thing that we have to do when working with any client is complete a consultation and an assessment. These are especially important to do early on when working with special populations, which people with orthopedic problems would certainly fit into that category. Your initial consultation should include many wonderful things, and one of those things is you filling out the PAR-Q, the health history questionnaire, and the informed consent with your client. If your client has a knee condition, there is a good chance that they will indicate it on the PAR-Q, the health history questionnaire, or both. If they do check any concerning boxes on either of those two forms, or if you feel that they have moderate to severe knee problems that could be made worse by exercise, make sure you refer that person to a doctor or physical therapist before doing any training sessions. How do you refer someone to a doctor or a physical therapist? Call or email them. That's really all you have to do. That being said, it's always a good idea for you to have some local professionals around you who you can trust. Anyways, after the consultation, you should do some form of an assessment. My assessment includes typical body measurements, a movement screen, and some physical tests. When I sign on a client with knee issues, I end up skipping a whole bunch of different things on my assessment. Depending on the severity of their knee issues, I may end up skipping portions of the FMS, which is the movement screen that I use with my clients. I'm likely to skip something like an Airdyne test, and maybe even the 3-minute step test. Again, it depends on how severe their issues are. If I suspect that something could make their knee condition or pain worse, I simply don't do it. So once our assessment is complete, we move on to full, real training sessions. And there are definitely a few pieces of information that we should take into account when designing this client's program. 1, their goals. 2, their results from the assessment. Did they feel pain or discomfort from anything in the movement screen or any of the physical tests? 3, referral instructions from a doctor or physical therapist. Obviously, this only applies if you actually have referral instructions from a doctor or physical therapist. With many of your clients who have knee issues, you will not have that. And 4, the severity of their knee issue. Minor knee issues are very easy to work around, and more severe knee issues are not. And we'll be talking about that more throughout the rest of this video. As the trainer, you need to find a way to balance all this information in your plan to get your client safely to their desired goal. So now let's get into some session creation with these clients. And today we'll do that by discussing some things that you should do and shouldn't do with clients who have knee problems. The first thing that you should do with your client with knee issues is start off very basic. And right about now, you're probably saying something like, "No shit, Jeff, you should start off basic with pretty much every personal training client." And yeah, that's true. That being said, oftentimes trainers are scared to try the basics with clients who have knee problems. And more often than not, they shouldn't be. Unless you're told not to by a doctor or physical therapist, or you have some reason to believe that squatting or deadlifting would worsen your client's knees, well, have them squat and deadlift. Obviously, there is more nuance to this, so let's get into that. One of the first things you should ask your client with knee pain is if they have pain getting up and down from a chair. If they don't, great, they're ready to do some slow and controlled body weight squats. If they do have pain getting up and down from that chair, how bad is it? And what is their form like when they're doing that? More often than not, many of these clients who are having discomfort squatting down to a chair, well, the reason that they're having discomfort is because they're leaning too far forward. And they're probably doing that when they're doing everything, it's just more noticeable when they're squatting. Unfortunately, this puts extra pressure on the knees and takes pressure off of the hips. Not good. So what you need to do is teach them how to squat and tell them to push their butt back, keeping the weight on their heels while they're doing that. If that still hurts, try to have them squat with the angle even further back, shifting even more of the weight off of their knees and onto their hips. More often than not, it's also going to be a good idea to have them start by squatting to a bench. If it still hurts after that, lay off the squats for right now, but consider trying the hips back version again in a few weeks once they're a little bit stronger. As far as deadlifts go, consider starting with light, slow, and controlled Romanian deadlifts. That being said, RDLs aren't the best for everyone, especially those who have back issues. So if they have back issues, you may want to avoid those for now. Avoid single-legged exercises like lunges, split squats, and probably step-ups. Although low step-ups might be worth trying. Your real bread and butter with clients who have knee issues will be exercises that focus on the posterior chain and don't put much pressure on the knees. Program upper body and core moves just like you always would, and we have lots of videos covering all of that already here on YouTube, so make sure to check some of those videos out. Something that you shouldn't do almost ever is have your client work through pain. If you're a trainer, having your client work through pain is almost never worth it. Best case scenario, you get that exercise that you're working on done with. Yay. Worst case scenario, you just hurt somebody else and also jeopardized your business relationship with a client. It's not a good idea. Don't do it. If an exercise hurts, have your client stop doing that exercise immediately. Hit your imaginary trainer pause button. No, seriously, I immediately stop the exercise that we're working on mid-set if they're feeling pain. And once we've paused that exercise, the first thing that we try to do is figure out where exactly your client is actually feeling pain. If they're hurting up here or down here, it's usually a lot less concerning than pain or discomfort right on the knee itself. If the pain is sharp or somewhat severe, totally change gears, stop the exercise altogether, and move on to something entirely different. Tell your client something like, let's give that area some time to calm down, and maybe we'll revisit that area later with a different exercise. Will you actually revisit that area later that session? Probably no, but maybe. If the pain is dull, more of an ache really, try a modification of the movement. The squat example works well here. Try to have your client push their hips back farther, putting less pressure on the knees. You will have to take this on a case-by-case, client-by-client basis. Every situation is different. Just remember, never push through the pain. Work around the pain and modify exercises when appropriate. My next thing to do is to do extra work on their posterior chain. And this would be true for their entire body, but when working with clients with knee pain, their lower body is almost always the bigger concern. So sometimes we'll know why clients have knee issues, and sometimes we won't. That being said, we can always pretty safely assume that if our clients do have knee issues, they're always going to benefit from extra strengthening of the glutes and hamstrings. A common trend that you'll see with many, not all, but many of your clients who suffer from knee pain is this forward anterior pelvic tilt posture. This was something that I talked about a lot in my video covering back pain, and that's because this posture can affect back pain as well. When you have a client with this posture, they are way more likely to suffer from knee pain, and that's because, well, simply put, their weight is more over their knees. This causes these muscles, the quads and hip flexors, to become tightened and short, and it causes these muscles to become long and tight. So what do we do with these long and tight muscles in the glutes and hamstrings? Well guys, we do what we do best, and we strengthen them to help pull them out of this position, which will take some pressure off of their knees and put a little bit more back onto their hips. Many of your clients have sleeping glute syndrome or dead butt syndrome from sitting so long. This is a real thing, I am not making it up. We have to make it so that their butt muscles work again, and this will help restore some balance to their body. On the off chance that your client doesn't have anterior pelvic tilt or dead butt syndrome, which is a hilarious name by the way, one of my clients calls it lazy ass syndrome, which is even better. On the off chance that your client doesn't have any of that stuff going on, extra strengthening of their glutes and hamstrings is still going to benefit your client and their knees in the long run. So now let's take a look at the workout chart so I can give you guys an idea of what a few sessions are going to look like with a client who has knee pain. Okay, so now we're checking out what 2 sessions might look like on paper for a client with knee pain. This client's main goal is weight loss, and they also want to safely increase their lower body strength to improve their stability around their knee. Let's assume that they're pretty much a total beginner to exercise. In session 1, we are doing slow and controlled bodyweight squats. We're doing some light Romanian deadlifts. We're doing some pretty high rep dumbbell bridges. We're doing some stability ball hamstring curls. And we're doing some lateral band walks with a medium resistance mini band. On our second session, we did bodyweight squats again. This time we did fewer reps, but we did do an extra set. We then did clamshells with a blue mini band. Clamshells happen to be a really good exercise for glute medius, which is typically a muscle that's going to be too weak on most people and helps to stabilize the knee. So yeah, do mini band clamshells with your clients who have knee problems. We're doing glute kickbacks, and for these we're actually just going to use manual resistance. Basically, I'm just going to put my hand on the back of Alexis's shoe here, and I'm going to provide her just a little bit of resistance as she's kicking her leg back and in a typical glute kickback position. We're also going to do leg extensions, again with that same blue mini band that we used before. And I'm showing you guys some pretty obscure versions of these moves, so you know some versions that you can do with your clients even if you only have very minimal equipment. Pretty much all the moves that we just talked about are knee-friendly exercises that are still effective lower body strengtheners, especially with new clients. There are many more examples of exercises like these out there as well. Our upper body and core routines look pretty standard. We're doing the tried and true pushing and pulling combos, and these parts of the routine remain mostly unaffected. I do like the ball transfer down here in the core section. By having my client really focus on squeezing the ball with her legs as she's doing this core move, she's actually performing a fairly effective inner thigh strengthening move as well. And for extra knee stability, it's not a bad idea to help her strengthen her inner thighs as well. And if we were to follow up with this client's workout chart in a few months from now, we'd expect to see pretty much everything having progressed and looking a little bit more challenging. And their lower body exercises would be no exception to this. We slowly and carefully need to make these lower body exercises harder over time as well. By the way, guys, if you want to use this workout chart or have some questions about how to use it, check out this video right here for more information. So now that you have a good idea of what a few sessions look like, let's talk about one last thing that you shouldn't do with clients who have knee problems. And that thing that you shouldn't do is forget about your client's goals. At this point, I've probably worked with hundreds of clients with slight to severe knee issues. Only a handful of those clients were primarily seeing me to reduce their knee pain. If their knee issues were moderate to severe, sure, they would definitely want some strengthening around that knee and some extra stability around that knee. That being said, their knee-related goals were almost always superseded by some other goal, usually weight loss. So basically what I'm saying is don't forget that they are paying you to achieve that main goal safely. Never lose sight of that main goal. Also, remember, you're not a physical therapist. Don't let your sessions become physical therapy sessions. There are people out there who are better equipped to handle that. Stay doing what you're good at. Just implement these strategies to keep everything moving smoothly. On that physical therapy note, if your client's knee issues seem to be getting worse, or if you feel that they need some work that is outside your scope of practice, do not wait. Refer them to a physical therapist right away. Your professionalism will be appreciated, and this is going to lead to better results for your client in the long run and better business for you as well. And that's all we have for today, everyone. Just like a lot of these other programming topics, this is pretty advanced stuff, and in no way, shape, or form did I cover everything. I'm sure I'll revisit this one in some capacity later on. In the meantime, do you guys have any questions? If so, make sure to let me know down in the comments. And if you haven't already, consider liking the video and subscribing to the channel, because both of those two things do help the channel to grow, which does allow me to create more free content for all of you. Thanks for watching, everyone, and until next time, stay sorta healthy.